Thank you for joining Lady Myya. I have Miss Jessica Phipps here. She is a public speaker. She is a disease self-management educator, and she's an award-winning social worker. Okay? Please, you guys, let's join Ms. Jessica.
Hi, everybody. Thank you.
Hello.
Thank you so much for having me, Lady Myya.
Thank you so much for your time, dear heart. We appreciate you. Okay, so you having as much experience as you do have. I do have a few questions because it's just the read your bio, and I was pleasantly intrigued. Okay, so what is it, or the differences in medical social work as opposed to regular social work?
Okay. So, first of all, in looking at the profession of social worker, we first need to understand that for somebody to call themselves a social worker, they must have a master's degree in social work. So social work pretty much has, people have called themselves social workers, people working in welfare, in the soup kitchens, and all over have called themselves social workers when they're actually case workers or social service workers. So that's the first way that you define a professional social worker, someone who's actually trained in the profession of social work and holds a license, a state license to practice social work. So medical social work, the medical social worker works in the medical setting, or even if they work not in a hospital or a public health clinic or other type of specialty clinic, they're working maybe with a health department in the health area. So those are the medical social workers. And then there are social workers, I mean, all through the, spectrum of life, to deal with every kind of, situation. So we have, social workers, they're in the police department, they're in the welfare department also, social welfare, they are in law enforcement, they are in schools, in a myriad of places. But again, the medical social worker deals with medical issues.
Okay. Well, no, that makes complete sense. We see them all the time, don't we? Well, let me ask you this. Okay, what type of advocacy are you talking about when you do your public speaking?
Okay, so with advocacy, I work along with the National Kidney Foundation, which is the premier foundation for the advancement of studies and advocacy and education for people with kidney disease and professionals who are in the area of kidney disease. So much of the advocacy that I do is legislative advocacy, where we're writing, getting legislators, federal legislators, and some state legislators to sponsor bills that positively impact the quality of life of individuals with kidney disease. As well as part of my advocacy, personal advocacy, is building awareness of kidney disease in the community, general community, and in particular the African American community. The African American community is of particular concern to me because we are disproportionately affected by kidney disease. The two major risk factors for kidney disease are hypertension and diabetes. Two illnesses, lifestyle illnesses, that disproportionately also affect African Americans. So that has also been a point of advocacy for me.
Oh, wow. I like that. Okay, you know what? Tell the truth, shame the devil, honey. Okay, so I wanted to know, like, what part of your career that actually stands out most for you?
The part of my career that stands out is I've worked with in renal care, the dialysis industry and the renal care industry for people with kidney disease since around 2004. And I've held many positions. So I've been a social worker in a clinic, I've been an administrator of a dialysis clinic, administrator of groups of dialysis clinic, I've done community education. And the part of my career that stands out is the community education, because I found that there were so many people who had kidney disease without realizing it, going to their primary care physicians who were not referring them to the nephrologist or to the kidney specialist in a timely manner. So thereby their disease was poorly managed. And they went on to having to be on dialysis, which is a life-sustaining treatment that replaces your kidney function. When your kidney no longer is able to function, you have to go on the machine, and that is what is going to clean your blood. So that has been the most impactful, and that in fact has been my inspiration to get my message out to the community. The fact that I've seen so many people who this could have been avoided. In many cases, they could have slowed the progression of the disease. They could have managed their illnesses better. They could have managed their life better and not even developed diabetes or hypertension. In many cases, diabetes, and most African Americans, most people have type 2 diabetes, and that is brought on by lifestyle. Okay? And nobody wants to do harm to themselves. They're just enjoying life because the fried chicken tastes so good. And this is the end product. So that has been being a community educator has been the most impactful in my life, because it's what has inspired me to take up the cause and say, I need to make a change. I need to help people to change, and I'm well qualified to do that. So,
no, I understand completely. You already answered the next question, so that was awesome. Okay, well, you know what? I just feel like if we understood and just kind of got like maybe the most common symptoms that we should be looking out for, just so that it makes us aware of what could be happening, or even like I know it's usually kind of weight gain, or just just less energy, or
right.
but is there anything that actually stands out?
Okay, so I would say, a lot of times we like to look at all the symptomology and how we're feeling to diagnose things, but let's make it hard and fast and look at your lab work. Practice preventative medicine. Get your annual checkup. If you get your annual checkup, for diabetes, look at your A1C, which is a 3-month measure of your blood glucose. So your A1C needs to be below 7. So look at your lab work. Take your blood pressure often, particularly when you're calm. Take your blood pressure and make sure your blood pressure is what it is supposed to be. And then thirdly, look at your lab work and look at your GFR, your glomerular filtration rate, because that is the number that speaks to the amount of kidney function that you have. And anything under 59, meaning 59% or less, you have kidney disease. So you want to look at that number. And, it is, like we say, oh, blood is blood, right? All blood is the same. Blood is blood if you do a blood test. If you look on your blood work, it's the only blood work that is designated African American and non-African American. Okay? So we need to look at that. We need to look at that. So, irregardless of the symptomology, look at your blood work. That is what tells the story and gives you the facts. Look at how it's trending, and if you're diabetic or you're hypertensive, which in most cases you would know, if you don't know, again, check your blood pressure, look at your A1C, maybe do a finger stick glucose and see how you're doing. People have symptoms, of course, the tiredness, the nausea, the swelling in the extremities and the ankles, the puffiness of the face, the bags under the eyes and things like that. So all of those are symptoms, but they may be symptoms of other things too, So we have to look at the hard and fast as to what is the symptomology for diabetes, for kidney disease, for hypertension.
Wow. Okay. No, and that makes sense. That makes complete sense, because there's so many different, avenues that can come from, and
right,
that will just set on you. You're trying to figure it out, and like,
right. But, you know, look at your blood work. Practice preventative medicine. Get your blood work done once a year. If you have a chronic illness, do it even more than that, whether it's quarterly or biannually, whatever your physician recommends. But get that done. Hold on to them and look at how it's trending also, you know, and don't just leave it to the doctor to look at it and tell you, okay, you're doing okay. Look at how it's trending. Is something, is your phosphorus or your potassium, is that trending? Is that trending up? It may still be within a range, but you can see from over time, if you looked at your last 4 blood works, it's trending up. What does that say? What is it coming on? What is coming on? What is it an indicator of, you know?
Right.
And look at what is not in range, because on your blood work, it tells you what is supposed to be, what is the range that everything is supposed to be. And if something is either high or low, you're able to identify it. And ask your physician questions. We need to be very active in our care. And in fact, when you go to your doctor, you're supposed to be having a conversation with them, but many people go and they just go there to listen to what the doctor has to say, like the report that he gives. And it's not about the report that he gives. You are the operant power in this. So you're the one who has to be able to ask the questions of the doctor. Be a historian. Come to the physician with a journal and say, this is how I've been feeling. This is what I've been experiencing. These are the incidences of concern that I have. And, you know, start the conversation with your provider.
Yes. Okay, so then that brings me to a whole nother question, because a lot of people may not say anything because they don't know what to say or how to ask. So what specific questions would you say that need to be asked, even if you don't know if that's, you know, something that you can like open the door for your doctor to explain to you?
Okay, so when we go to the doctor, you need to be able to tell him. I always tell people it's good to keep yourself a little medical journal, get a little book, and you know, anything out of the ordinary that happens, you want to tell the doctor, like, okay, you know, I'm beginning to have dizzy spells, and anything that happens to you, think a little bit about what were the circumstances around it. So if you have an incident of concern, think about, you know, was it that I went out walking and I was tired, or I was dehydrated? Think about the circumstances around it, because that is what is going to give the physician the cue about what's going on with you, in addition to the lab work that he's going to do. So lab work tells half the story, but you need to be able to tell the story too. So you want to be able to talk about what has happened, talk about the over-the-counter things you may be taking, because a lot of people take herbal supplements, you know? So all the medications that you're taking, whether you're taking it from that particular physician or from other physicians, you want to bring all your medications to the doctor and have them look at it. And because in some cases, they may be knowledgeable of the drug-to-drug interactions if your doctors don't talk to each other, and in many cases, they don't. And this is why it is so important to fill all your drugs at the same pharmacy, because then your pharmacists are able to see all the things that you're taking, especially if you're having, you know, medications called in by different doctors. So there are no drug-to-drug interactions. But yes, you want to talk to the doctor about any concerns that you may have from incidences. You want to find out about whether, you know, there are any immunizations you may need, because there are adult immunizations that you need to get at certain times, you know, whether people are getting the flu vaccine or they, you know, for shingles as you get older, you know, different things. So you want to talk to him about that. You want to talk to the physician about, you know, looking at your lab work and how it's trending. You want him to be able to explain anything that is out of range, either high or low on there. You want to talk about that. You want to talk about your mental health also. A lot of times we don't touch on mental health, but you want to talk about how you're feeling about these things and anything that is progressing. And then also, you know, in order to age healthy, we want to ask the doctor, okay, at this stage, what supplements should I be taking? Because as you get older, your absorption, let's say, of your calcium, your vitamin D, sometimes isn't what it used to be. So do I actually need any additional supplements? You know, what tests should I be doing because of my age? You know, when is it time for my mammogram? At what age should I be taking a mammogram? So you need to ask the doctor, what tests should I be taking given the fact that I am a 50-year-old woman, you know? Should I be looking at bone density tests, you know? Asking about all those things, what tests you should be taking, what lab work you should be doing. And I think it's important that we initiate these questions because they're seeing a million patients, and while we want them to think for us, they're just doing their job. Just the same way the cleaning lady comes and like vacuums your carpet, you know? They're doing their job. It's routine for that. But it's about you taking care of your body for you. And you need to take good care of your body, because if you don't take good care of it and it can no longer function, you're going to have no place to live, right?
True. That's true. Okay, okay. I got a question. I love that one. You got no place to live. What year did you get your social workers award?
So I got my social work award in 2011. So I was the social worker of the year for the National Kidney Foundation, for the Council of Nephrology Social Workers.
Nice.
Yeah.
Okay. Did we get a pin, a watch?
Oh, I got a big plaque. I have it up on the wall in my office, so I can't show it to you, but I did get a plaque and a book and and a couple of other things. Very, very prestigious award. It's the highest award you can get in the practice of nephrology social work. And also to mention, I'm a fellow of the National Kidney Foundation, which is also a very prestigious award. They started this a couple of years ago, within maybe the last 6 years, and there are only maybe about 4 social workers as distinguished. It's reserved a lot for physicians, mostly physicians on there. I'm one of the few social workers, so it speaks to my expertise and my dedication to helping. I did a lot of groundwork in nephrology social work in terms of standardizing assessments to be used across the country, education of professionals. I would speak on an annual basis at the conference, educating not only social workers, but other allied care professionals in the importance of social work and social work practice.
That's amazing, because like, wow, you are so well versed. And that's a great thing, because you can see the heart on you. You know, you have such a rapport that you even explain to little old me about like taking care of my body, really being active, and like what I should be looking out for. And the way you explained it was just so caring and just so like inviting. It's like, okay, maybe I do need to, bring this up and be attentive to it. So I'm definitely seeing why you got those awards, dear heart, why you got your nomination. So is there anything we can look forward to your business?
Yes, so my business is called Better Your Living. I started in 2003 in order to create a platform for health literacy, because health literacy is something that is lacking in our community. I think across the board, but in the African American community, health literacy is a big thing. So health literacy and for chronic disease education. So what you can look forward to is I am actually pivoting my career, sort of quote unquote out of social work, and getting into health and lifestyle management, because I think that is where I can best serve. I am going to be launching my website and launching my disease management programs. I already do speaking, but speaking at a different level. I did speaking within the academic community. I am changing the paradigm a little bit, and while I'll continue to do that, I want to speak to the general public. I want to have a platform to speak to people across the board, to show them how to buy into their health, how to take responsibility, how to best use the health marketplace, how to have the fortitude to create a healthy lifestyle and maintain it. Because, we all could do these fad diets and everything and then fall off the bandwagon, but you want to be able to maintain it and create a lifestyle for yourself. So not only you could be healthy, but you can make health into a family affair, where you take care of your parents and you get them to understand a different way of doing things so that they live longer to be with you, to carry on the traditions of the family. And you want to have your children involved. so that they will grow up with a healthier lifestyle. So 2 generations forward, we're going to be different people. We're just going to live a healthy lifestyle. We're just going to get up in the morning and, take the first 15 minutes when we roll out the bed and do our exercises before we move on for the day, because that's what some cultures do. You know what I mean? Like the people, they wake up, they do their Tai Chi, So we need to get to that point to make a healthier community. And that is going to be the secret of our wealth building.
Yes.
That's
Okay.
going to be the secret of our wealth building.
Yes, we're going to do that. Okay, she's going to be the one to look out for you guys. Is there any, you said the website is?
So my website, it's Better Your Living, just as you spell it, www.betteryourliving.com. I'm going to be making some changes because right now it's just for my academic speaking business, but come July 1st, I'm going to be creating memberships so that we can be all in this together and get healthy together. I'm creating a movement so that, and I want people, as I said, health is a family affair. So it's not just for you. You want to tell your aunts, you want to tell your uncles, you want to tell your sisters, your brothers, your children. We want to create this into a family affair and take care of each other and just change our whole lifestyle.
Wow, I can see that happening because everybody is just like, okay, I need to at least do something with all this energy that I'm so used to doing all these extra things. And now it's just like, okay, the stir craziness is setting. I need to do something. So this is what we can do, people, my Mayans. Listen, we can get better. We can do things, we can do the meditations, we can do, the exercises that she actually has, and make that movement and be with other people, and just to have those accountabilities, to do it together is just phenomenal. And it's just going to take your mind and your body into a whole different frame that is just going to benefit you so greatly. But we appreciate the time that you have spent with us, you guys. Thank you so much, Jessica. You have been so phenomenal, like phenomenal. Like the words that you said and how you said it, it was very, very on point with everything that you said. And I appreciate that, especially since the Mayans, we could do better. we could do better.
Well, thank you so much. Thank you so much for having me. And you can follow me on Facebook at Better Your Living, BetterYourLiving. It speaks to what we all want to do to better your living. So you can follow me on Facebook. I have recipes up there. I have a lot of health information that you can follow. So like me on Facebook, and I'm looking forward to launching Better Your Living programs come July. And we can talk again and really get everybody into this and make a change. Thank you.
Woohoo! All right, you guys, like, share, and subscribe. Please give this to someone that you know that it needs to do a little bit better, and maybe they might even hold you accountable as well. So, maybe you don't want to do it. But you know what? You should, because you should. We love you so much. Thank you so much for living your best life with Lady Myya, or just this can be manifesting your living, and living manifested, and manifested your living. Could be so many different things. Thank you so much. You guys have a great one.